Isn't everybody? Thanks so much for here today for one of a series of stakeholder live streaming and this session. Commissioners, just be a conversation, hear your perspectives. I'm share a little bit of context about the mission, a little bit of a repetition. Commission members, and if you've been following the commission closely, things you've already heard, but also and then each of you, as we indicated in the email, a chance to just briefly hit some highlights of what you are expecting. Share them. Share them all. Later they also. So you all know that every 10 years, the council careful with the taxes. Last one was in 2013. They did advance some pretty major changes, a lot of which the council and the mayor actually did adopt. We have big shoes to fill, and at the same time, we know that changed over the last decade, particularly over the last few years. Changes in the tax base, changes in community. So the commission feels this is a really important opportunity and moment to rethink the tax system. The goal is to propose to the mayor and council set of commissions that meet a set of principles that this commission laid out this year. That's right. Recommendations that we adopt should be following based on sound research, be based on the experiences and needs of people across the district, and should be devised collaboratively to ensure rule changes. We should have a range of perspectives on it. The intent is to work together to come back. In these recommendations, we've agreed as a body that the commission on a broader, resilient tax base for this post-COVID economy to protect against economic shifts, shocks, and ensure that future funding and share tax burdens. 2, progressivity, eliminate racial disparities, protect local. 3, economic efficiency and competitiveness, enhance growth and prosperity. And number 4, open and fair administrative to reduce compliance burdens. So where we are right now in the timeline, we are in a period, midway down, 3-week period, of convening about 10 meetings we think can bring really important perspective. Also holding a couple of public meetings next week with members of the general public to present their perspective. May 1st in person, May 4th. Those are on our website. And the committee still taking in information. The commission has not ruled anything in about some of the big challenges that face our tax system, and just to name changes in the economy and the impact of that. Parts of it do hit artists that people with least ability to pay. The tax system has a number of tax breaks that benefit relatively small taxpayers. If the context of federal law that shields leaders from taxation, economic competition from our neighbors, We have aspects of the tax code that reinforce racial inequity. And we have the reality that folks find our tax system is too complicated. These changes don't really lead directly or clearly to solutions. Some are technically difficult, some are pretty complicated trade-off. Presented with a number of different policy options. To do that as we process developing into a list that can be. So we're going to be doing that later in the summer and into the fall. Now and then continuing to engage in research. So you'll have additional chances to weigh in various forms through. We know that we have a really hard job. The Commission did a tremendous job together, set of recommendations. Those were adopted by the council. It turned out that those recommendations were feeding into a period of time purposes and sense that to cut taxes, that's what happened. All the provisions that were passed across DC revenues. It's not clear this time around the policymakers are going to have the option. Now, to be clear, we haven't gotten a specific direction one way or the other. Council should options. But that's just a few words on this challenge. So as I said, today is about listening and learning. We're really happy to answer questions that you have about this process and suggestions in particular about how we do ideas. You won't hear opinions from us, but you might hear some points of questions. So I'll stop there again, ask down the line and just ask each of you to share your name, your organization affiliation, those, and just a brief summary of what the perspective you represent and details you can summarize. And then we'll open up for Q&A questions. You and then the final thing is, I know we sent out a bunch of questions in advance for you to work on. You know, we will be posting the recording to the web and also writing some commissioners, particularly those commissioners.
Able to make necessary changes for the tax system.
Very good.
Let's defer to the end.
Yeah, absolutely.
Well, I'm delighted to be here. Thank you. I'm Andrew Flagel. I'm the president and CEO of the Consortium of Universities of the Washington Metropolitan Area, which represents all 18 colleges and universities that are based here in the region, as well as large visiting institutions, Virginia Tech and cultural institutions, and the Smithsonian. But our primary work and founding back in the 1960s was around DC colleges and universities, that are based here in the district. And as you know, and as the chairman just mentioned, our universities provide tremendous service to the district and are critical to revitalizing downtown. We educate students for the workforce and support initiatives in sustainability, reducing food insecurity, increasing access to affordable housing, and for our partners here on the panel, delivering healthcare. Our institutions are at the forefront of research, from AI cybersecurity, and quantum technology to reducing gun violence in our own community. At the same time, it's important for the Commission to understand that our DC universities are often at a competitive disadvantage. DC provides very limited need-based aid to our own residents, especially compared to Virginia, Maryland, and most other major metropolitan areas, making it more costly than our competitors in other regions to fund our own high-need residents. Programs like the Mayor's Scholarship and Futures Fund are great examples of ways we can start to make our institutions more competitive by retaining and upskilling our talented residents. Despite those challenges, this year we estimate that our DC universities enrolled over 14,000 district residents in degree programs and awarded those students over $180 million in scholarships and financial aid. We also received less partnership and promotion support than many other regions, and as you know, the district does not have the depth of philanthropic tradition from the private and corporate community that is established in many of our competitor markets. Our institutions are also facing tremendous demographic challenges. On the enrollment cliff, nationally, we are seeing a steep decrease in the population of traditional college-age students, and it's even steeper in our own region. That presents the most competitive environment for enrollment in history to attract talent to the city. On the other hand, it's a tribute to the strength of our institutions that, unlike other major metropolitan areas, our universities are not under existential threat. Other cities have faced terrible closures. And just last week, one of the largest institutions in Chicago announced huge cuts and layoffs due to their enrollment needs. Nevertheless, our DC universities this year employ over 12,000 district residents who are receiving over $800 million in compensation from our universities this year. To help this city, our institutions must continue to thrive, and we need tax and economic policies to support them. This includes support for expanded student and employee housing at both our private and public universities. It also includes supporting public-private partnership for innovation and research zones that attract federal, philanthropic, and corporate investments. Most of all, because we receive far less from the government than our competitors in other regions, it's critical that no changes in the tax structure harm the efforts to grow our DC-based universities. Instead, we hope the city will look to our institutions as bold partners in attracting talent, investment in companies to the region, and developing the workforce and equitable economic development that is needed to revitalize our downtown. Here, we'll be answering your questions.
Yeah, and then
Just flip to the house.
yeah. So thank you. My name is Christopher B. You have my formal testimony. Certainly echo everything. And I want to maybe sort of put it through the lens of one member, one. Georgetown, we're the oldest district. It's part of our DNA. And in looking at the goals of the tax commission, we really echo the broad idea of the need to build a stronger space, promoting diversity, ensuring economic efficiency. Those are concepts that we are deeply trying to support in our current work. And sort of in that spirit, I think I would echo the comment that from a higher education perspective, the current tax code is working for us. We're not getting a lot of support from the tax code or from the government, but tax code is hindering our ability to sort of make progress. And I wanted to just take a moment to share some examples of how Georgetown is sort of using its institutional abilities to help achieve those three goals and contribute to the town and the city. And I would say, although I'm here speaking for Georgetown, I know that every other DC-based institution, they would have their own version of story that I share with you about. Okay, for ways that we're helping achieve the commission's goal, try to just, I mean, in terms of building a stronger tax base, you know, we throw some numbers at you. First, we employ about 7,000 people, about 2,100 of them in the city. We're the city's largest private sector. We have 21,000 graduate students, more than 11,000. Economic impact on the city is significant. Our employees, they live in the city, they work, they pay taxes in the city, and like our students, they rent, buy the neighborhoods, they streets, they feed businesses, restaurants, they bring tourists, they spend time. And we're looking to grow. In addition, the quality of our job really inspires to be a model of very progressive living wage policy. We employ thousands of people, variety of skill sets and education levels. So it's not all hyper-educated people. We've got people from all over the education. We have generous benefits, probably more generous than most employers. And we apply to people. Say, this job, you get one of the benefits. But beyond our impact employer and students, we also have, you know, aware of our institutional economy. And we're growing. And so that should be something that we think is applaud. We're looking to grow outside our hilltop campus footprint. Folks traditionally think of it. We're looking to expand a new Capitol campus law center downtown. So we recently built a residence hall down there. We are building a policy building down there. We purchased and renovated 2 buildings. Interestingly, the 2 buildings that we recently purchased were buildings that formerly housed federal workers. GSA gave up the leases. So somebody needs to build them. So it's something a little bit sort of almost countercyclical. At a time when pandemic, you know, people are leaving downtown, a lot of telework, harder to fill buildings. We're trying to help build that by bringing and enlivening, bringing people to it. And the other beautiful thing about higher education is that primarily it's an in-person activity. So offices can work through their own telework policies, but our students need to be live present and they need to live near. So we think that in some ways higher education is sort of the ideal kind of activity seeds help catalyze development. And obviously Georgetown isn't alone. Looking just to name a few other examples. Where George Washington University is really working with its relation to things that's trying to revitalize the economy. Universities doing amazing things for Shaw now, that override. And some of the out of town schools with John Hopkins, BM and USC recently. So we just would really urge the commission not to suggest anything, not to recommend anything that would harm our ability to continue to invest in the city at the time. You all want us to step up. So not a surprise that featured in the mayor's comeback plan. Higher ed and research recognize 6 areas for high growth sector. And about being one of the 2 downtown university clusters expected to I could talk for quite a long time about ways that we're trying to activity and racial activity. Just name a couple examples. There are too many to name, but you know, from our older, long-time clinics that have for over 50 years been providing services to pro bono legal services. To some of the more newer initiatives like our Prison Justice Initiative, which is working with people in DC jail and also working that they have. We just last week, in fact, on Exhibition Day, dedicated a new route for instance, cancer prevention that is going to bring much needed cancer education and testing services, screening services to communities that historically been underrepresented. So I could go on and on. Policy research, policy initiative to bring academic policy issues. And then, finally on the economic city and regional economic issue, Andrew talked about the federal research dollars that Georgetown and our into the district, traffic dollars into the district from outside the city, spending them here, helping the strength of this economy. And then when you think about us as a driver of talent attraction, when I was getting ready today, I looked up some numbers to share. So I mentioned that we enroll about 21,000 students, 11,000 of them in the city. But what you may not realize is that many of these students were living in DC before they came to Georgetown, as undergrads, but as people who came to us for upskill. And so we are promoting thousands of people's careers to develop them as talents. We're also bringing people from the country to come. Many of them, interestingly, end up staying in the district. 22,000 of our alums, just about 3% of the district's population, live in Washington. 3% of the district, and 60,000 are. So, to make the, I know several members of the commission for Georgetown. We know that we're honored to be one of the primary higher education institutions, training existing talent and then attracting, educating outside the region, kind of staying and making a region of competitive cities. So, in conclusion, I would just say the commission knows better than most policies to incentivize behavior that society wants to disincentive behavior that society doesn't want. We argue that higher education is in fact the kind of activity that we want to see in the world. Stronger tax base and cheaper. Just in closing, would urge you not to hinder our ability to achieve.
My name is Justin Palmer. I'm the Vice President for Public Policy and External Affairs for the District of Columbia Hospital Association. We appreciate the opportunity to speak with you today. The District of Columbia Hospital Association is the unifying board for to advance hospitals and health systems in the District of Columbia. Our membership includes 13 hospitals, which are federal, investor-owned, nonprofit, and district-owned hospitals. Our members collectively employ nearly 30,000 workers and have a total effect on the district's jobs effect on the district's economy of 43,156. Our payroll and benefits exceed $2.9 billion, and the overall impact that hospitals have on the district economy is nearly $7.5 billion. As you carry out your work, we believe there are opportunities to improve equity, promote residential growth, and stabilize the district's workforce. When we look at the hospital's workforce in the district, we find that more than 70% of hospital employees live outside the district of Columbia. And make no mistake about it, DCHA and our members are committed to strengthening the pipeline of district residents into the healthcare industry. To that end, through the assistance of the DC Workforce Investment Council, DCHA's subsidiary established the DC Healthcare Workforce Partnership to promote the alignment of programs and create pathways across the entire sector, not just hospitals. We recommend exploring targeted tax incentives for healthcare workers in order to promote home ownership, whether it be down payment assistance or tax credits, as well as professional growth opportunities through education tax, as we seek to retain and recruit talent into the district hospitals provide not only the 3% uncompensated care requirement that the certificate of need process requires, but also on top of that, tens of millions, hundreds of millions of dollars community benefits, which the nonprofits are report on the schedule of each community. Moreover, like our university colleagues, we invest in public safety departments to protect our staff, patients, and property. One of the items that our members have brought up to us and recommend that the district look at tax revision commission look at is how we look at tax provisions for nonprofit healthcare and health science research institutions that may try to take advantage of federal new market tax incentives, historic tax credits, or opportunities in financing structures. Nonprofit healthcare and health science institutions leverage these federal programs to raise capital for qualified strategic projects, and as a consequence, incur local property and income tax. The strategic projects include expanding health services in under-resourced communities, rehabbing historic and sometimes abandoned buildings, and investing in research and development in the district. These are all direct incentives into the district's economy that create jobs, support local companies, and revive under-resourced communities. A revision of the tax revision would incentivize these institutions to invest in healthcare expansion, research, and development in the district, which we believe would have a benefit for the overall. So the post-pandemic recovery and revenue challenges of the district are clear. And finding a balance of the diversity of tax revenue to insulate from future downturns is important, especially any reliance on any one tax. I believe that building the district's reserves is key to continue to provide that buffer and support fend off major shocks to the system, and also monitoring expenditures to make sure that we can avoid harmful effects. As we look at the different sectors and how the pandemic recovery is affecting, we have to be sensitive of when it comes to hospitals. We have seen expenses grow by 20% between 2019 and 2021, according to Kaufman Hall, which has made operating hospitals much more difficult given the financial constraints. Hospitals across the country have seen 14 straight months of negative margins, with the Northeast Mid-Atlantic region just starting to show fairly a little better results in the first part of 2023 than other parts of the country. I believe that additional taxes at this time without new revenues would further exacerbate the financial condition of our members. Looking at the tax administration, we do encourage a simplification of the tax structure and making sure that the systems work effectively. Our members have highlighted some audit and refund process concerns with the current system that creates lengthy business tax audits that with little communication with feedback that continue on for some time. And lack of familiarity with the district auditors with federal tax programs also lead to complicating and extended audit process, which can frustrate businesses. Overall, I think the work of the commission and looking at the equity is really a wonderful opportunity, and we look forward to supporting these.
Good afternoon. Let's start off with stakeholders. Mr. Help does support comments that we shared.
Hi, good afternoon. John Conley, Associate Vice President of the Tax Situation University. Working. I don't have any. However, I echo everything it said, and I'll just say this one additional comment, and that is, whenever we bring someone on to work at the university, and I try to sell the university, say, a lot of times with Georgetown's decisions that we make, maybe don't make the best financial sense. We always do. And that exemplifies the kind of partner, the type of business that you want here. I would also encourage you, if anything within our ability to grow and
all right. Thank you all for your comments. Well, This time,
So, a question I would have is, how could the universities have a role similar to the role of, say, colleges? So, I get a mixed up.
Drexel and Philly.
Carnegie Mellon and Pittsburgh, cities, diversify. And whatever happens is. We know that. Look at the university. Beyond what they're doing now, celebrating what they're doing now. Diversify the economy. I would also say the same thing in hospitals. You look at major areas where, you know, the city. One area is good. Is in healthcare, certainly the hospitals and have, you know, every reason in this region to have a greater percentage of research. So anyway, but the universities help us diversify. What incentives from the district would be instrumental in helping.
So my tax expert here may know more of the specific incentives. I will say that I'm not as familiar with the Drexel model, a little bit more with Carnegie Mellon, and the president for advancement is a GW. So we can get deep dives into some of their information too if we need. And they just finished $1 billion nonprofit campaign. So you'll be delighted to have the fundraising just. The part of that was, and part of the model of Dayton's another one where University of Dayton is taking over a big swath of town, Michigan and Flint, where the community, the city, incentivized, which kind of goes to what Justin was saying in terms of tax incentives. Incentives for businesses to partner with the universities for the projects, which allowed research firms, investment firms that wanted to collaborate on research and tech transfer to get cost effectively into the development. So I'm happy to do a little more digging and provide feedback to the commission on what the best model structures are that we've seen from universities. I know there's been a great deal of discussion already with Chris reference, particularly with the innovation district. And so there are discussions underway for sure. We're at tipping points for a couple of our universities on research level. In fact, Howard is poised to be the first HBCU in the country to have the highest level of research university. And that should be both an incentive to business and investment, federal investment, and also community pride that can drive use of properties that are under. As Chris mentioned, the way maybe you want to talk more, Georgetown moving into buildings that were otherwise going to down is a great example of universities going in. But one last piece, which is I also think some of the incentives you mentioned, the purchase of housing, the potential of universities for adding housing for faculty, staff, and students, for expanding our number of individuals who are residential in the district, is another way that we can explore really interesting public-private.
And is, I get the opportunity and it seems the economic impact is in that, but I'm talking shop. Presence of the university. Take a lot for granted, you can't take a lot for granted. This is really important.
Absolutely.
And I agree. I think in some ways, federal government, because it takes up so much oxygen in the room, has a strategy that you're talking about. You know, I think one of the things that I've learned working, we're each unique, each have a slightly different model, different experiences. I think sometimes outside both So come and sort of say, what's your specific area of expertise? What's your specific area that you're trying to advance? You get a bunch of different answers, and then you might be able to sort of craft a strategy that either incorporates or sort of emphasizes some that are maybe of higher potential than others. But I do think that the more people think of us as one monolithic sector, the less effective we're able to be in terms of helping to drive economic growth.
There's some of it that we've begun to develop. So the collaboration around quantum, which is both our suburban and our DC universities, and it led to the Quantum World Congress being anchored here in DC, which you know well from your work with Connected DMV. That's driven largely by the university partnerships and has huge potential for expanding work in the region. And that really speaks to the potential of attracting students to the region, which feed that workforce, attracting business to the region. The biggest magnified effort is if there's a collab, we know what HQ2 did for National Land, assuming that they don't pause building forever. But the Amazon trajectory was such a big win for that region. And that was a huge collaboration with the universities to woo that business. So being, one of the things that I've been an advocate for 30 years, and you and I have talked about several times, Mayor, is and this really goes to what Chris says, we are rarely when we're trying to attract conferences, when we're trying to attract businesses, we do not lean into the expertise and the specialty of our universities. Even when we're trying to attract tourists, the campaigns that we do don't recognize the massive number of individuals who come here just to tour Georgetown University, not to just to walk through the Georgetown streets, but to go on tours of the university. And so other regions, and Philadelphia is a great example where they were very intentional about creating websites, attractions, purposely pushing folks when they visit to see the universities, when they're coming to the universities to do other things in town. So pushing that integration and community pride, advancing our universities.
Other commissioners have questions,
Sure,
but I'm just saying we need to up our game. I mean, like.
I agree with
Newton
her.
and University of Pennsylvania played a huge role in the city. So we need to up our game here.
I just want to, Chris, I care a lot about Georgetown. My nephew graduated from Georgetown, Jonathan. And just yesterday or Wednesday, he was inducted into the International Business Honor Society as a guest speaker.
Congratulations.
But I just wanted to bring to the attention of everyone here, I could not sit here and have this conversation without saying, I am also a trustee at the University of the District of Columbia, which is a second HBCU in the city. That university also brings value to the city because it does indeed have most of the historically Black population, the low income population matriculated in that institution. We're also the only public institution of higher ed in the city. We're the only urban land grant institution in the country. So as you are putting together your model and your formula for how the institutions of higher ed in the city could benefit from the tax division commission recommendations, please from now on, if you would include UDC in your conversation, I think would be a great thing.
We absolutely.
Also ask that you think about how the other institutions, Georgetown and all the other institutions can partner with UDC. Because we want some space downtown also, because we do think that housing is a deterrent, if you will, to us not increasing our enrollment, even for the young people who live in the city, who want to get higher education, to become educated in the higher ed system. So just think about how you can partner with us to do those things. I think that would be a great plus. And I'm sure the mayor would be very, very happy because in her comeback plan, when she talked about institutions of higher ed, I will say she left out.
Oh, nor do we. And I spoke extensively with Ron, and his data is included in all the numbers I shared with you. And when I was speaking of expanding housing, that's one of our largest opportunities. I'll also say the consortium our universities in DC have one of the oldest and boldest
collaborative cross-registration systems in the country. Students at UDC can take courses at Georgetown and Howard at no cost to the student. And I will say until 5 years ago, that was run on carbon paper. So we are in the midst of a really transformative transition to fully automating that system and making it much more accessible, which allows us to do levels of collaboration with our public institution that I think should make it the potential. If the other institutions get tired of me harping on it, I think the potential of UDC as a regional powerhouse has been underestimated. And the ability to put that on steroids through collaboration with universities and business is an incredibly exciting element. And then when you look at University of Pennsylvania's work there, when you look at University of Michigan's effort in Detroit and in Flint, there are great models for leveraging our interaction with our privates, but UDC as our public anchor around that expansion. So I agree entirely.
I have a few questions that I was thrown on there. So one is just, I hear you saying do no harm on the tax policy front, but I wonder if you could elaborate on what are the things you think do harm. We talking about specifically. And, for DCHA, if you wanna, I don't know much about some of the like the federal market tax credit, or tax credit, those pieces that you're talking about, if you want to explain a little more. And then for both, you noted that a slice of your workforce lives here in the district, but a lot of folks live outside. And I just wondered what you all know about that and why you think so many of your employees live.
Justin, do you want to start? We can talk.
Sure. I think we're digging into the federal new market tax credits, but when you're looking at Children's in the Innovation Campus, MedStar and the Research Institute, the opportunity for research and development in healthcare and what we can do to really bring that to the next level, I think has a great potential. We have a lot of, just like the collaboration between universities, we have collaborations between the hospitals and simply Hopkins Medicine and Children's with some of their cancer work, the collaboration between the universities and the hospitals, and from a healthcare education, it takes a village to meet the needs of where we are going to need to develop the workforce. UDC from a healthcare workforce partnership is instrumental to that, particularly in both the workforce and nursing. And I think we're greatly looking forward to the relaunch of the LPN program. That is a really a growing rebirth of that degree in healthcare. So I think we're looking at how we can continue building. There's Macmillan that that has supposed to have a healthcare function to it as well, and looking at the innovation and you have any information on the institute that you want to share. But I really think how we continue the collaborations between the universities and the hospitals and the work that's already being done to create those new, whether it be new companies or spin-offs, to really drive that research and really make DC a healthcare destination when you're looking at Cleveland or Minnesota and those kind of investments. And we will follow up on more of the specifics. There's a lot of work being done in the district, and we're excited about what the potential could be and figuring out what those right investments are from a tax credit. I mean, as I mentioned in the testimony, the pandemic, the influx of some of the provider relief funds, we're able to stabilize the hospitals. But when you're looking at the margins, it's really the economics of healthcare right now is trying to reset post-pandemic. We're trying to figure out what that new normal is.
Yeah, if you could help, and feel free to follow up and help us understand the through line between the new market tax credit.
Absolutely.
And what the district specifically with DC government can do to help with access.
My understanding really is that there's just a little bit of a disconnect of when the tax credit, some of the funding that comes through that then becomes taxable, like it's not considered tax exempt, even if it's a nonprofit institution, from whether it be income or a property tax perspective. So even if it's a nonprofit, I will get more specific, because I only have the briefings, little briefings that I got from members, but would love to follow back up.
And I guess I was going to answer just a question about sort of example of tax money, and many of the folks around this table know this is how they could predict it and say it, is that I think the district's paid leave, the universal paid leave bill that it passed recently, the university is 100% supportive of the goal of the bill and the mission of the bill. But there was, I think it was sort of, it was flawed public policy in the sense that it put it as a payroll tax. So, you know, anything kind of broad level, anything that is like a payroll tax is probably gonna hurt us disproportionately. In that particular bill, because it painted with a very broad brush in a way that I think it could have been a little bit more subtle. The universities end up paying more into the district system for a less generous leave policy than our employees had in the 4 days. And our view was just tell us what the minimum requirement is, and we will meet or exceed it. I promise you we would exceed it. But then don't tax us. Let us handle this on our own. And there were policy decisions made that was I think I would say it's been slightly mitigated by the reduction of the tax rate. So it's a little easier on us now, and we still supplement the benefits the district is providing because we didn't want our employees to have their benefit levels cut. But you know, sort of anything that sort of taxes employment like that is going to be harmful. And I would argue, you know, businesses, employers tend to do less of what's taxed. So why would you want to disincentive our creation, or our job creation ambitions? And I don't know, do you want to weigh in on, I mean, my sense is probably cost of living.
Yeah, I think, you know, maybe the studies from the DC Policy Center may be more helpful with figuring out why folks want to live in the suburbs versus, or the exurbs versus downtown. But it is a constant challenge because for our universities, we would prefer that folks live proximal to the campus. When there is, you know, we have individuals who feed and care for students every day. We have our security staffs, our folks who shovel the snow and fix the pipes, cook the food. And just like the hospitals do, when there's an emergency, we got to find places for them to stay when they live outside the district because we need them here. So there's a sunk cost to our institutions when they live further out. So we are big believers in it. And in fact, we launched a study. We got a small grant from the Amazon Housing Equity Fund to study ways that universities can be more proactively engaged in expanding affordable housing. So we have that on our website, and we're now working with one of the national banks on scheduling a series of working groups around how we can begin to execute even further. Some of our institutions have already moved pretty far in that direction. A little bit more at the suburban institutions in downtown, but that potential, and I know there's an Urban Institute study that looks at hospitals in the same way, being partners with the local government and with investors in developing expansion in affordable housing proximal to our universities is what it's helpful to us as we're trying to attract talent. So we're very, very vested in more residents in the district, particularly because we're such huge employers and it's to our advantage to have them living near to us.
Well, it's interesting that you mentioned that because there was an article in the New York Times of all places that actually used NIMBYism in some neighborhoods in Berkeley as an example, not so much that Berkeley needed this or that expansion space, but basically as an example of where zoning is a big inhibitor to affordability because, you know, one of our own people, Maureen, is over in Paris, and she, you know, actually just did some back of the envelope kind of like calculation. Paris has a foot similar to DC, a population far larger than DC, with a building height limitation. And the only big difference is much more widespread uniform density and much more affordability. There's much more diversity of income. I mean, it's still a European city where it tends to be rich, but much more working class in the city than in DC. So it's interesting.
Yeah, the idea of creating a more residential I mean, this is something that universities obsess about. The more we create residential facilities around our kid, the more it feels like a campus, right? And the more community it creates, the less tension there is with our neighbors when you're affiliated with the university living around us. In fact, some one of the things that's being explored in some municipalities is UBRCs, university-based retirement communities in and around the camp. Michael Crow at ASU calls it his coolest dorm ever. So the idea that our universities in long-term planning can really think about investing in the community, and it can be an investment in a whole lot of very productive ways.
But those are the kinds of things that I was talking about.
Yes.
Universities can help diversify the.
Absolutely. It is, and there are models all over the place, and it takes a partnership with the government, with the universities, and with the businesses. So most of those things, when they are produced, are a tripart, P3, a multi-partner arrangement to make those work.
You will not get an argument from us that land use policy in the district is overly regulated.
And challenge, right?
Region has a very strong concentration of life sciences, but that's all around like 270 corridor. And the ability to attract more businesses engaged in that has been challenging. Obviously, the Jump Labs is a really great example. It's a lot of time and effort and a unique combination of supports to get there. What are you hearing both as universities and as the hospitals from your partners in that world, and as to why they're, if you're hearing it?
I don't know if we've heard specifics related to the hospital side. I can't speak to, but I can find out.
Yeah, it's just really not been appropriate. We do a tremendous amount of research in the district, not specifically with types of businesses.
I really have a question, which is kind of just like this conflict in my own mind. Back to the pilots and employee tax that the previous commission in 2013 recommended. We were just discussing yesterday the conundrum of this period versus the previous commission of, well, we're just short money. We got to look at new places, and we talk about fairness. And if you look at a map and you see what's taxed and not taxed, you say that brings up questions of fairness. And it also strikes me compared to, people who dwell in office buildings or who have institutions that are more mobile, they can literally on a dime move out to Roslyn or Crystal City or Silver Spring, whereas probably Georgetown or a hospital is going to stay put no matter what. You might expand less, you might have auxiliary offices elsewhere, you might do something else. But when you look at us as a commission trying to look at, for-profit firms that don't pay, it's really the same dynamic here. And then it's compounded, say, that you don't have in a state with just one taxing jurisdiction, most of your employees don't pay taxes here. So while other cities and states may have tax exempt universities, at least they're capturing all the income tax from people who are employed on campus or at the hospital. So, it just strikes me though is, I just wonder, has somebody looked at what is the value of the land that you occupy and the foregone taxes of residents versus what the community contributions are? And my guess is it would probably be a net negative for the city still. And so I just wonder if you have any, we kind of look at like 42% of the land in the city is untaxable, 50% of the income in the city is untaxable. And it strikes me like a lot of people who used to argue against the federal payment say, well, yeah, but if the federal government weren't here, you wouldn't be anything. Well, sure. You can say that about any business, the larger businesses especially. But But we're here with this conundrum of, yes, we definitely appreciate and acknowledge the tremendous community value. I'm one of the 3% of the alumni of the university that's stuck around. Yet the city's short of money and people, and we need to look at people that aren't paying because nobody really thinks that people that are here aren't paying enough. There are a lot of people that don't pay at all. So I think of your employees, if I go back, so forget the pilots for a second. What about the old idea of an employee tax, which is kind of, I'll use the word desperation, what you do when you've got to have some of the people that are here using city services pay something.
So there are some academic settings that I've been told, but I haven't seen them. I'll track them down, share them with you. But what I've been told by some of our own tax experts at Georgetown is that there are certain subsidies that come with hospitals and universities. You know, the garbage, as you say. But what his comment to me was that just what you were saying, is that the impact of that, the multiplier effect that you make by making that subsidy is significant. And that there are plenty of other examples of things that we subsidize at the government, at the jurisdiction, that have far less impact. So the idea of being able to have, you know, thousands of students and employees, you know, in the city spending money, the employees paying taxes, the students, you know, for those who aren't residents, like grad students, but they're undergrads, they're spending money, their parents are coming to visit. The analysis is that on net, it is worth that incentive, that subsidy, because you're getting more than you're giving up.
Well, and I'll echo that, but I also challenge some of the economic assumption that you made there, Greg. I think the idea that universities can't move, because we do have universities in the district that have opened up suburban spaces and have the ability to think about where they would locate and make an nexus of some of their work. I don't think that's the intent. I think there's a huge advantage to being in DC, but I'll reference what I just talked about in Chicago. So if you look nationally, just to mention the precarious financial situation of hospitals, I have to say higher ed is at a real pain point moment. Our ability to, so what has happened is our discount rate, the amount of financial aid provided, is accelerating faster than the increases in tuition. So we are providing more and more financial aid, and the need of students is growing faster than our ability to provide it. We don't get a subsidy for that from the district the way most metropolitan areas have, which puts us at a, as I said, a disadvantage. The most flexibility in every university's budget is that financial aid budget. That's the place where universities have the most swing. We either lay off employees or you dig into financial aid. That's the flex point in the budget. Because our production is the production of students. And you don't need to look much further than the news this week in Chicago, where they laid off 1,300 employees all because they are short on their enrollment and they can't keep. That's a big hit to Chicago. So that's my concern is the idea that universities are underpaying and that taxing them would suddenly provide income would very easily become countercyclical because our universities are very enrollment dependent in a highly competitive environment, and the loss of revenue we saw in pandemic. We had some layoffs until the federal money started to build some back up. So it's not an unrealistic concern that you would see a significant reduction in income in the district from the universities that would more than offset the gains that the taxes been.
I would also say that I don't think hospitals are impervious. I mean, the hospitals are not impervious. Since the last tax review commission, we've gone through the closure of Providence. And so hospital finances are important. I think the investments in the uncompensated care, the community benefits, I think there are a lot of costs that that we are attempting to kind of quantify for the first time when it comes to patients that are difficult to discharge, what that means in the long term. You know, we have hospitals that have patients 300 over 300, 500, 1,000 days, and that is not reimbursable medical services to the community. And I think as we look at what that outreach is, I think, yes, hospitals and universities are anchor institutions, but I think we have to be cognizant of taking them for granted on what some of their pressures are the same as others. And I think, the investments in the safety, public safety spheres at all the institutions, and it's certainly becoming more and more
Ironic
important in
is-
hospitals.
These are almost the identical arguments made by for-profit developers downtown who talked to us a couple days ago.
Yes.
Almost identical arguments. And yet they pay a lot of tax.
Well, I think as it relates to healthcare organizations in the city, amidst our health, we contribute hundreds of millions of dollars of community benefits, things that we do not get paid for in the District of Columbia, whether it's subsidized care, so services that we provide at a loss, some of the research that we do, education of medical, graduate medical education, hundreds of millions of dollars. And then we look at the underlying business, hospitals are generating 1% to 2% operating margins. So $1 on every $100, that's the profit. And then we take that money and we reinvest it back in our facilities. So that's kind of the economics of the healthcare organization, not-for-profit healthcare organization, particularly operating here in the district. So there's not a lot of flexibility for additional taxes. If taxes were to rise, you're going to see it's going to have to come from somewhere. It's going to come out of some of those community benefits that we're providing. Understand your point about people who are working in the hospitals who are maybe not living in the district. But it's really important that we attract those workers to DC, to our hospitals, because we want to be able to provide dignity care here in the District of Columbia to people who live here. So again, I think while I understand the point, it's really important that we attract those workers to come into the city to work in our facilities.
We have divisions not to stop at one of the 8 hospitals they pass on the way coming in. And that's part of why we want to try to grow hospital workers in the district, but that is part of the challenge too.
Yeah, I'm just curious, I've done so much stuff downtown. Where's that growth coming from? Is it everyone at the graduate level? And then, when you do these transactions in the downtown area, are you paying deep transfer recordation taxes? Are you paying property taxes on those buildings? I don't know the answer, so I would be curious to know.
So the growth is primarily graduate, but interestingly, and this also kind of goes to your point, Frederick, I can't speak to developers' comments, but we also operate, any of the universities that are in residential neighborhoods operate under campus plans. And I always say, can you imagine going to Apple and saying, there are only so many iPhones that you can sell this year? But that's essentially what the district does. Yeah. So there's only so many of this kind of student and this kind of student. And so our finances do, it's a balloon, and you push on one end and it's gonna have unintended consequences somewhere else. And I don't think the district is gonna like those consequences. But in answer to your specific question, it's primarily graduate, but we're actually experimenting with, for the first time ever, having a DC-based undergraduate program. So this would be like a kind of a study abroad experience, but in the city that your school is in, but sort of more focused on the national public policy world, and political world in DC. So it's for the first time we're putting our toe in that world, and that the graduates, the policy school going on there will have we're going to launch an undergraduate policy program. See how that goes. But in answer to your other question, no, I mean, they are coming off tax rolls if we bought them from a private developer. It's something we bought them from.
But there are, I'm looking at the tax guy to see if I get this right. I don't want to misquote, but I'd like to feed back from some of our tax experts on this. So there are investments in properties in the community that are still in the tax rolls that the universities are invested in. So there is a mixture. Not all of the buildings are off the tax rolls. But I do think one of the, to go back to that broader point, unlike the private developers. To go back to Tony's point, the universities and hospitals are one of the major ways that we grow a community. They are one of the assets that attract business to the community. They should be usable. I think some of the other towns where you're going to see major layoffs or university closings, that takes a big hit, not only to the immediate population, but to the reputation, the ability to attract that talent. Most private industry can't. They're competing with other private industry. We're actually in the business of the more business we attract and help you attract to the district that helps pay taxes, the better that is for partnerships for our universities, the more employment for our students. So I think there's a much more robust partnership with colleges and universities than we've had. And that we could have even more strongly in the future that would help spur business rather than seeing it as just a direct income source that would harm other.
Well, and I agree, I wouldn't underestimate the catalytic effect, right? We're going downtown. There are two buildings that used to be filled with federal office workers. They weren't our buildings, they'd be empty. We have 500 students living down by 501st. The Walmart down there closed. Well, if they give it a little more time, the students that live there, you know, we kind of opened that door right as it closed. I think you're gonna also see additional, we've already heard from foundations and other think tanks that wanna co-locate with us in other buildings nearby. So I think we have to think of these things, you know, for the policy reasons that these exemptions exist. They do provide this catalytic effect that has tremendous spillover effect. And I think it's gonna make the city, that end of that part of the city, which is right now, you know, we've done a lot of work on Union Station. You know that right between Union Station and downtown is a bit of a dead zone. We're hoping to kind of, as Union Station is redeveloped, we would like to, you know, help weave the downtown core and Union Station together. So it's not a challenge that sort of takes long. So I think there are other benefits that are well worth that.
And universities and hospitals are 24/7. So you do get a lot of effect at different hours than you get with a lot of traditional businesses. So that catalytic effect, as you look at some of it, as you talk about what's happened in Pittsburgh or in Dayton or in other areas where they've tried to re-energize downtown, they utilize partnership with universities rather than trying to pull them in.
I really appreciate it.
Just in addition to the new mark tax credit, the point about audit and refund practices, you could get back to us a little more detail.
Absolutely. And I think that is a challenge from just how the city communicates with the businesses under audit to understand what the expectations, what the timelines are, and then also I'll get more specifics.
Yeah,
And then,
which taxes and so on.
yeah.
Other questions?
Do you want to say?
I was just gonna say that you had mentioned, what's the hindrance? How would we hinder you? And certainly the university does value and appreciate its property tax exemptions, absolutely. We do pay some property tax, though. There are some buildings that we do pay property tax on. You know, in the district, you need to own and occupy your building to be tax exempt. That's the starting point. I would potential deals that we would consider, which is private and part of 3P, where we would, a stumbling block to get there has been, as soon as we do that, it's no longer property exempt. So we really do value our property exemptions. Honestly, that's one of my, I was telling Chris, I said, I'm gonna go to that meeting because I really believe, and I wanna do all I can to safeguard that. But additionally, that would really help the university if we could maintain some sort of exemption, even if it's a limited exemption on that.
I should know this, but I don't, but the bookstore and tax and sundries and the hotel on campus.
We pay private activity, essentially, private activity.
But so if you have a new building that's on downtown and you're doing it through a PPP, it's no longer tax exempt.
Correct.
But if you were to lease the top of that part.
If we were to lease the,
Yeah, let's say you,
To them.
let's
Just
say
the exemption.
you lose the exemption or you lose the exemption for the section.
On the portion.
On the portion.
The latter, yeah.
All right. Well, thank you guys so much for being here. We really appreciate your time and the insight, and hopefully we'll be in touch about it.
Thank you all for the
Some
work
of it as
you're all
we go
doing.
forward.
We appreciate all the support you're all doing.
Thank you for the dialogue.
That's what we do.